uterus, that's the wall now, or within the cavity. So we're going to talk about the various types of fibroid. So when it's tiny, it's possible for the patient not to even know that there is fibroid. So it could just be an incidental finding for someone that has gone to the clinic or any other procedure, and then the doctor requests for scan. And during that process, now discover that the patient also has fibroid, meaning that the fibroid has been there, not causing any problem. So you don't need but sometimes it's so huge that it could make the woman appear as if she's pregnant. And more often than not, people that have this kind of huge abdominal extension, they will come across doctors at one point or the other that have told them about opening surgery. But because they don't want to open surgery, they continue to endure the pain, the discomfort that comes from symptomatic uterine fibroid to the extent that the tummy will be as big as what we have on the screen. Next slide, please. Now, these are the various types of fibroids. Like I said, we have bit on, which is the subserosa. It's outside the uterus. And we have the other one that is very common, the intramural, that's within the wall of the uterus. And then we have the submucosa, which is the one that is now inside the cavity. Is the least common, but is the most troublesome of these three types, because that is the one that usually causes heavy flow in women when it is present. Next slide. So now there has a lot has been said about what is responsible for fibroids, and you get to realize that most of our celebrities too, they've become specialists overnight about what is responsible for fibroids in our environment. Some of them, they've said a lot of things about what is responsible for fibroids. But up till now, we've not known what is responsible for fibroid, what causes fibroid. Well, we actually have some risk factors. These risk factors, when present, doesn't mean that the individual must have fibroid, but it increases the chances that the woman is going to have fibroid when they are present. Now, the commonest one, age-related risk factor. Like I said, in women, late 30s or early 40s, they are at a higher risk of having fibroid. Black race, so it's commoner among Black women than the white people. And also, we have family history. So a woman that has fibroid or a mother that has fibroid, her daughters would have higher chances of having fibroid in future. Then we talk about hormonal imbalance, and that is when those who are blessed in size, obesity, comes in, because it's actually the effect of estrogen, excessive activities of estrogen, that leads to fibroids developing. And then the last one, which is combined oral contraceptive pills. Now, this one doesn't mean that when a woman needs contraception, you can't give them combined oral contraceptive. You can do that. But when you place them on it for so long, it could increase the risk of having fibroids. Next slide, please. Now, like I said, most people have fibroids and they don't even know about it. Some know, but the fibroids are not symptomatic. They don't do anything about it. But when it becomes symptomatic, what are those changes that you are going to observe that will alert you that you have symptomatic uterine fibroid? One of it is a woman may observe that the tummy is increasing in size gradually. When you touch the lower part of the tummy, you will feel something like a hard lump at the lower parts of the tummy. Or when you lie down, you observe that the lower part of the tummy is bulging out. That tells you that there's something growing. When you touch it, you feel something hard. It's possible that the woman has fibroids. Now, in terms of the flow of the woman, there could be increase in the menstrual flow, which could manifest in the form of maybe the number of days could increase, Someone that is seeing a period for 3 to 5 days, it could increase to 7 days or even beyond. Or it could manifest in the number of parts the woman is using could increase from, let's say, 2 to 3, could increase to maybe 5 or even more. And then there could be associated passage of clotted blood along the line. So when you observe all this, it's possible that the woman has fibroid. So other symptoms include painful menses. Someone that probably before was just having a period without any issue. All of a sudden, she starts having an intense abdominal pain. Or peradventure, someone that was having mouth pain, the intensity of the pain could increase. And also from pain to sexual activities could become difficult. When something that should be what you enjoy will become something that the woman is not looking up to because of the pain she could get as a result of that activity. There could be increase in going to the toilet to pee because of the pressure effect of the fibroid on the urinary bladder. So the woman could pee more often during the day or at night. Other pressure symptoms include constipation. The woman may not be able to use the toilet regularly because of the effect of the fibroid on the rectum. And sometimes they just have this discomfort at the lower part of the tummy as a result of the mass effect of the fibroid. So when all these symptoms are present or any of these symptoms is present, the woman should seek help. Next slide, please. So when you visit the clinic, the doctor will examine the woman and then request for certain investigations. Now, because the woman is losing a lot of blood, the doctor will want to know her current blood level, so full blood counts will be done because of the effect of the fibroid on the kidneys, and also because the patient will need intervention later on. So you want to know the kidney function test to be sure that the kidneys are functioning well. So renal function test will be done. Imaging, then the commonly performed one is ultrasound. So the doctor will scan the patient, and during that you'll be able to confirm whether the patient has fibroids or not. But for us that we do Hifu here, what we usually request for, we do scan before, and then we also request for magnetic resonance imaging, which is the imaging study that we use to confirm that the patient has fibroid. Because there is also another gynecological pathology that also appears like fibroids on ultrasound. And this has led to needless surgeries in some people. That's okay, the surgeon probably thought the patient had fibroid, only for them to go in and discover that it's not fibroid, but adenomyosis, because it appears like that. But on MRI, we'll be able to confirm what the patient really has, whether it is fibroid or adenomyosis. Now, adenomyosis is just having the lining of the womb within the wall of the uterus, that's the muscle now, such that when the woman is menstruating, she's also building into the muscle, and that makes the muscle to swell up. So the woman could present with intense abdominal pain. So it is important for us to confirm what we are dealing with before you treat the patient. And more importantly, we can use Hifu to manage both conditions, both fibroid and also adenomyosis. Next slide. So when you've confirmed your diagnosis, what are the options that you have? Now, for someone with symptomatic uterine fibroid that is perimenopausal, that's the woman is already having symptoms of menopause, we could offer them expectant management. So you wait, you watch, you just manage the symptoms and wait until the woman transitions into menopause. Because of in menopause, there's withdrawal of hormones, so the fibroid naturally begins to shrink, and then there is improvements in the symptoms and quality of life of the patient. We could also give medication that could help the fibroid to shrink. Now, the commonly performed procedure, which is the open surgery, it could be achieved through various routes: open mammectomy, whereby they make a wide incision on the tummy to remove the fibroid. And for few people, they could offer them what we call hysterectomy, which is removal of the womb itself. This is usually deployed in those who have completed their family size. They are not interested in getting pregnant again, and they are not really bothered whether the uterus is preserved or not. You can offer them hysterectomy, so which is the removal of the womb. Then the non-excisional procedure, like uterine artery embolization, whereby a contrast is injected into a particular vessel to block the blood supply to the fibroid, so it becomes a dead tissue afterward. But the problem with this is that it's not usually advocated for people that still wants to get pregnant because it could affect their fertility potential. The last one, which we're going to be focusing on, if you look at the image down there, that is Hifu, high intensity focused ultrasound. It is completely non-invasive treatment option for symptomatic uterine fibroid. Next slide. So these are just images of various ways by which we can remove fibroids. The lower one is an open mammectomy. These are fibroids. This is hysteroscopic mammectomy, which is minimally invasive procedure whereby you just insert an instrument into the inside of the womb to remove any fibroid that is within that space. And then this lower one here, laparoscopic procedure, could also be used to remove fibroid. There are criteria that we consider before we can offer patients all these options of treating symptomatic uterine fibroids. Next slide. Now, the main focus, which is Hifu, high intensity focused ultrasound. Hifu is relatively new, about 4 years now in Nigeria, but outside the country has been there for a decade now. Now, it's completely non-invasive treatment option for symptomatic uterine fibroid, and it uses ultrasound wave. So it is not laser therapy. It is not radiotherapy at all, because people usually make that error that it is radiotherapy, it is laser therapy. No, it's just a normal ultrasound wave that we use to scan, but the machine has the ability to convert that ultrasound wave at a focal point and then generate its energy, which is what we can see on that image. So that energy that is generated is what we now use to take out to destroy the blood supply to the fibroid. So after Hifu treatment, the fibroid becomes a dead tissue. And the moment we achieve that, the body immune system and certain cells in the body now moving, and they begin to act on the dead fibroid tissue. And that is what results in gradual reduction in the size of the fibroid. So when the reduction starts, there is improvements in the symptoms of the patient, the heavy flow, the pain, the tummy that was very big before will begin to go down gradually. And we do scan at interval to monitor if that reduction is occurring. Next slide. Next slide. So this is an Hifu image of Hifu machine. This is our control section. This is the bed that the patient is going to lie face down. And then the box over there contains the power source and also the water source. Next slide. So who are those that can benefit from Hifu treatment? People with symptomatic uterine fibroids or adenomyosis. Patients with symptomatic fibroid that cannot tolerate surgical intervention. We've had instances whereby they've opened a patient up, maybe they've done open surgery before, and then they open them up and realize that because of adhesions, they can't get to the fibroid again, and they just do what we call open and close surgery, meaning that it's like hopeless situation for that patient because they can't do open surgery to remove the fibroid. But a number of these people, we've been able to do Hifu for them. So meaning that Hifu even has this extra advantage over open surgery for those who are perhaps have been like, okay, you can't benefit from open surgery. So what other option do you have for them? So we can always take advantage of Hifu in those people to manage their fibroids. So those who have asymptomatic uterine fibroid, because we have people that okay, they know they have fibroid, but it's having a psychological effect on them. They just want that fibroid treated. We can do Hifu in those people because with Hifu, it will stop the further growth of the fibroid, but rather now begins to increase in size. So next slide. So how do we prepare patient for hypo treatment? You come in, we interact with you, we examine the patient, and then we ask you to do magnetic resonance imaging, which is the MRI, which is what we are going to use to confirm the diagnosis. It's just fibroid alone that you have, or there is associated adenoma also, because more often than not, they usually occur together in some people. And then it helps us to rule out if there are other problems. Maybe the patient has malignancy. It helps us to rule out that. And then we prepare the patient for treatment. Next slide, please. Now, is it everyone that can benefit from hypo treatment? The answer is no. Now, we have relative contraindications and we have absolute contraindications. Now, for relative contraindications, what do we do in these people? They can benefit from HIFU treatment, but what we do is that we do simulation, we put them on the machine and check whether we can safely get to the fibroid. Once we ascertain that, meaning that the patient can benefit from HIFU treatment, but we just need to have this initial simulation to confirm that. People with type 7 fibroid, those who have done liposuction, because the liposuction, the area that they've stopped out the part has scars. So it could create shadows along the path to the fiber. So that's why it's important for us to put them on the machine and confirm that. Next slide. Now, absolute contraindications will be in the form of those who have cancer of the reproductive organ, be it endometrial cancer, be it cervical cancer, because it is now important to take care of something that is more life-threatening first before you go after a benign condition. Because the fibroid is a benign condition, whereas the cancer is going to affect the patient first. So it's important that you get it treated before considering them for HIFU. Those who perhaps have had radiotherapy for whatever reason, be it intestinal malignancy or reproductive organ malignancy, you don't want to do HIFU in those people. Or someone that cannot lie down for at least 1 hour, maybe because of a back problem, you don't want to recommend HIFU in those people. Next slide. Next slide. Next slide. All right. So what are the advantages of using HIFU to treat fibroid? Like we said, it is a non-invasive treatment option, meaning that we are not cutting the patient open. So the patient has the advantage of going on that same day. So after you've rested, the patient is at home. Because it's also one of the uterine sparing procedure, meaning that after treatment, the uterus is still intact. The patient can still achieve conception after HIFU treatment. The HIFU only targets the fibroids. It does not affect the surrounding normal tissue. So, maybe HIFU is going to affect my ovary, affect my fertility potential. That doesn't come in because we focus on the fibroid, and that is what we treat. It does not involve the use of general anesthesia. A number of people that have been subjected to open surgery have lost their lives as a result of general anesthesia. What we do is conscious sedation. We give medication that will even allow you to be able to communicate with us throughout the treatment, because we want to know how you're feeling during the treatment. Fast recovery, within 24 to 48 hours, the patient can resume back to our normal activities. Those business people that they don't want to leave their shop, maybe because they don't trust the people that they have in their shop. You can come and have your treatment Friday. By Monday, you can resume back to your shop. And even those who are working in companies that they hardly release their staff to have time to go and treat themselves can have their fibroid treated with Hifu without much downtime. So 48 hours, you are back to your normal activities. Next slide. So, as I've stated earlier, it is not a radiotherapy, it is not a laser therapy. So, the fear of maybe to cause cancer in the future does not even come into place at all. It is cost effective because of short hospital stay. Within 1 to 2 hours after treatment, the patient leaves the clinic. And because we are also not cutting the patient, there's no risk of no need for blood transfusion. And then the other advantage is the fact that even if the blood level of the patient is lower than 30%, we can still go ahead to treat, as opposed to open surgery, whereby they will ensure that the blood level is at least 30% before they take the patient into the theater. In as much the patient is not symptomatic for low blood level, you can go ahead and treat. So that helps to even reduce or prevent the attendant complications of blood transfusion. People have contracted HIV infection from blood transfusion, even though it's not common, but it's a potential complication that can occur. People have lost their lives as a result of blood transfusion reaction. And you see that Hifu helps with prevent all those complications. You are welcome. So when we compare risk, Hifu has low risk of complication when compared to open surgery, which we're going to look at all the possible complications that can arise as a result of open myectomy later. Next slide. So if we look at this image, the one on the left, laparotomy, you can see I don't want to use the word lobby now, you can see how nicely look the anterior abdominal wall is. This is a woman that has undergone open myectomy. You can see the scar. But this person had laparoscopy, so you can see scars at 3 points here, here, and here. But the one on the right, you can see that the skin is intact. Nobody will know that this person has had fibroid treatment at all. And the individual can still go to the field and still rock her nice skin. Nobody will know that she has undergone treatment for fibroid. So that is one of the benefits of using Hifu to treat fibroids. Next slide. So in terms of recovery, you can say that within 2 days, the patient will resume back to normal activities. And we even have people that within 24 hours, you are calling them the following day. You ask how they are doing. In your mind, you feel that the patient should be at home resting, but the background noise is disturbing you and you ask, where are you? She's telling you I'm in the market. So that tells you how amazing Hifu treatments can be for symptomatic uterine fibroid. Now, for open surgery, the patient will need 4 to 6 weeks to recover. And for the other one that is also non-invasive, which is intranatal, no matter what, the patient will still need about 2 weeks for recovery. So Hifu is quite amazing. Next slide. So what are the possible complications that can arise as a result of symptomatic uterine fibroid? Now, because the patient is losing blood, they could have anemia, low blood level. What are the symptoms that the patient would observe? Dizziness, tiredness, panting after a short walk. So those are the symptoms of low blood level. It could affect the kidney because the fibroid could compress on the ureter, which is the pipe now that brings urine from the kidney to the urinary bladder. So there could be renal damage as a result of symptomatic uterine fibroid. Now, the next point, which is infertility. Usually, we say that fibroids don't cause infertility because most people get pregnant with their fibroids. However, we have instances whereby fibroid could block the two, and sometimes it could also affect the outcome of the pregnancy. If you look at this image here, this is a fibroid and this is a growing baby. Now, if you look at the next image, you can see that the fibroid has increased in size, compressing on the growing baby. At the end of the day, this patient had miscarriage as a result of the fibroid. Now, the next point is malignant transformation, meaning that a benign tumor, which is fibroid, could transform to cancerous type. Although it's not common, but it's a possibility that can occur. Now, obstetric complications, these are the effect of fibroids on pregnancy. A patient will have what we call red degeneration, meaning that pain, usually within the first and usually second trimester of pregnancy. It could lead to miscarriage in a number of people. And because the fibroid could cause distortion in terms of the way the baby is presenting, it could increase operative deliveries in those people. And after delivery, sometimes it will not allow the womb to contract very well. So the patient may bleed excessively after delivery. So these are some of the complications that can arise as a result of symptomatic uterine fibroid. Next slide. So these are possible complications that can follow open surgery, which are not present with Hifu treatment. One of it is anesthetic complications. Like I said, a number of people have lost their lives as a result of general anesthesia. Now, bleeding, because you are cutting the uterus, sometimes the surgeon may find it difficult to arrest the bleeding. So the patient may lose a lot of blood. And if that occurs sometimes, the patient, you go in for myomectomy. You just want to go and remove the fibroid alone. Well, because of bleeding, what they did not plan for may have to be the final solution, because you have to keep the patient alive first. So they may end up doing hysterectomy, removing the womb, which was not the purpose for taking the patient to the theater in the first place. And sometimes they may, like we said, blood transfusion, because the patient is losing a lot of blood. So, and then blood transfusion could come with attendant complications, blood reaction, which could even claim the life of the patient as well, and could also predispose people to infections. Next slide. So far, we've treated over 800 patients, and we are still counting. About 86% of them were due to symptomatic uterine fibroid. About 11% due to those who have fibroid coexisting with adenomyosis, and those who had adenomyosis alone, 3%. So about 14% of the people that we've treated actually have adenomyosis. That tells you that that condition is quite common in our society. Next slide. And Hifu has really offered an option in managing this condition, because for adenomyosis, the main treatment is removal of the womb. But with Hifu now, is giving hope to patients who have adenomyosis. At least they can manage the fibroid and still go ahead to look at getting pregnant. So what are the challenges that we have? Limited Hifu centers. We only have 2 centers in Nigeria, one here in Lagos and the second center in Abuja. We hope that in the future we'll be able to have more centers. Now, for healthcare insurance, right now we really do not have all these HMOs subscribe to Hifu treatment for symptomatic uterine fibroid. Not everybody can afford it. But then if we have HMOs come on board, at least they'll be able to encourage a lot of people, because they will subsidize the cost for the patient, for those who cannot afford it. Now, cultural beliefs and treatment perception. Now, a number of people, maybe because open surgery has been the way by which we be managing symptomatic uterine fibroid. People believe that effective treatment of managing fibroid has to do with removal of the fibroid. And the answer is no. The main thing that fibroids, or let me say the main issue with fibroid is symptom, heavy flow, pressure symptoms. And once you are able to take care of those symptoms without removing the fibroid, you've been able to achieve the same thing, which is improving the quality of life of the patient, which is the most important thing. So the fibroid doesn't necessarily have to be removed before you can achieve improvement in the quality of life of the patient. So the next aspect is a limited scale. We have very few Hifu specialists in Nigeria. We hope that more people will be able to come on board. And as a result of this limited expertise, people in a way, most times when they go out to have scan outside this place, usually do not know what to really measure. So that when we are measuring the fact that it's different from what they are measuring, because then what we look out for, which they don't have the requisite skill to look out for that change that has occurred. A patient is telling you that, oh, my tummy is going down. And the doctor is scanning the patient, he saying that the fibroid is the same or even bigger than the size before Hifu treatment. It doesn't make any sense. The tummy is going flat, and you are saying the fibroid is increasing. It's because they don't know what to really look out for. So we hope that with time, when we are able to train more people, they will get to know what to look out for when they are scanning the patient after Hifu treatment. Next slide. So frequently asked questions. Does Hifu cause cancer? I think I've been able to address that. Hifu does not cause cancer because it is not laser therapy, not radiotherapy. It's just the normal ultrasound that we use to scan routine. Does Hifu affect my fertility? The answer is no. A number of adults have been able to conceive naturally after Hifu treatment, and some do have other issues being because of their inability to get pregnant, and they come for assisted reproduction. They've been able to achieve success following Hifu treatment of their fibroids. Can we repeat Hifu? The answer is yes. And this, I will also use this to answer the question about recurrence. Now, if I do have to really take care of future recurrence of fibroid, any procedure that does not involve removal of the uterus, in as much the uterus is still present, you have that risk of having new fibroids coming up in the future. So with Hifu, once we treat the ones that are there, they are dead, they continue to reduce in size. If new ones come up in the future, you can always benefit from the repeat treatments of those fibroids. Next slide. So in conclusion, fibroid is common among women within reproductive health. These are people between 15 to 49 years of age, and is especially our home disease because it's common among Black women. So with right information, which is what we are sharing today, medical guidance and community support, because this program that we're hosting today, we are doing it in conjunction with TAPA. So with that community, you'll be able to navigate the challenges that symptomatic uterine fibroid can pose and live a healthy life. Thank you. So this is our contacts. All right. Thank you for listening.
Thank you.
So we take a question and answer.
Yes, thank you so much, Doctor, for that wonderful presentation. Yes. Thank you. So do we have any other person that have questions?
Can I ask?
Yes, you can have directly.
Yeah. Thank you for your what you have just told us. But then what I'm really concerned about is I have some sort of understanding of, how fibroid grow on the uterus. And what I'm really concerned about from how you have described Hifu is, I can understand Hifu like killing the cells of the pendulum-related fibroids, which are the ones that hang outside the uterus. What are the ones that hide in between the scenario wall?
Okay, all right. So we use Hifu to treat four types of fibroids. The intramural, those are the ones within the wall. And then you have an overlap sometimes, will be within the wall and also an extension into the cavity. We also use Hifu to treat that. But the ones that we probably like, okay, we may not want to use Hifu for the one that is sitting completely inside the womb, we do use stereoscopy for that. Now for type 7, I said that we do simulation, we check to be sure that the pathway to that fibroid is safe. Once we ascertain that, we can use that to treat the subserous, the pedunculated, the intramural. So we use it to take care of all the types of fibroids, the submucosal, the intramural, and the subserosal.
So the ones that inside the
And the one that is completely sitting inside that's the cavity where the will stay. Yes.
that one.
So we do stereoscopy to remove that, while we do Hifu for the other
Oh, you mean
fibroids.
mastectomy?
No, no, massive. It's stereoscopy, it's stereoscopy, the non-invasive.
Within
Okay, can you go back so that I can show her the image? I have an image on that. The hysteroscopy is minimally invasive procedure. We are not making any cut. This particular one, we are not making any cuts on the tummy at all. And it also has the advantage of the patient coming in on the day of the procedure, and she also goes home that same day. So we just do this in the theater to remove the fibroid that is sitting inside that place.
this can be done alongside Hifu.
It is done at about 3 months after Hifu treatment.
All
Okay.
right, thank you for
There's a
that.
question on-
Doctor, thank you.
No, they said there's a question. Okay, the question says that how many sessions does one need for the treatment, or is it one-off? All right, now for most people, a single session is usually enough to take care of their fibroid. But we usually individualize treatments based on the size of the fibroid, the size of the uterus. So that is what will determine whether the patient will need more than a session. But for most people, a single session is usually enough.
All right, thank you, sir.
Okay.
All right,
Okay.
bye.
Good morning. Thanks, sir.
You're welcome.
So I want to ask. During the course of the lecture, it says whether you're affecting kidney or it's sitting. Or does it? Is there anyway, does it completely affecting the thyroid and it causing like vagina disease? Is it related in any way?
No, fibroid is not related to hypothyroidism or hyperthyroidism. It doesn't have any link to that at all.
I have a question.
Okay.
So, when Hifu cuts off the cells and the blood supply and stuff,
Okay.
the less blood that is left, how does the body inject it?
Okay. Now, after the Hifu treatment of the fibroid, the tissue is now dead. There's no life in it. So this activates certain immune system in the body, and certain cells that we call macrophages, they begin to work on the dead fibroid tissue. So that results in gradual reduction in the size of the fibroid. Now, the fibroids are not ejected.
It won't cause any infection.
No infection at all. No infection. Nothing like that. So they just continue to reduce in size, and it's a continuous process.
All right, thank you, sir. I have some questions. Thank you, sir. All right, so I have some questions here. The first one says, after the use of Hifu, is there any hope that the fiber will not regrow?
All right, so the fibroid that is treated, once the fibroid is dead, usually the fibroid doesn't regrow. They continue to reduce in size. But like I said, that in as much the womb is still present, new fibroid nodules could come up. And those ones we can always treat when you have new fibroid and they become symptomatic. We can always treat them with Hifu again.
Okay.
Yeah.
Why is it that patients with communication difficulty are not involved in this program?
Okay, if you look at the relative contraindications, I put it as one of the relative contraindications. So it's not that they are like, okay, they can't benefit from IFO treatment, but the adjustment we just need to do is to probably give them a bell that, okay, if you have any discomfort or you want to communicate with us, maybe hit the bell or tap the table, something like that. You just give them specific instruction because most of them can write. Or perhaps they come with someone that when they have issue, they signal to the person and the person will communicate with the doctor. So we just make just little adjustment to be able to cope with that challenge. And they can definitely benefit from Hifu treatment. It's not absolute contraindication, it's relative.
Thank you for that. Also, can the Hifu treatment be used for fibroid of 14 cm or more?
Okay. Now, for fibroids above 10 centimeter, we can use Hifu to treat them. Sometimes, like I said, you may just need more than a single session, and a session may be enough to take care of the fibroid. We usually individualize the patient's treatment. The size is not an absolute limitation to Hifu treatment of fibroids.
Okay. One more here. Can Hifu be conducted with someone with right renal disease?
Okay. When we have associated pathology, like maybe medical or surgical in some cases, like this one now, a neurological problem now, we usually co-manage with specialists. We refer the patient to them for them to evaluate the patient whether we can go ahead with the Hifu treatment or not. After their evaluation and recommendation, if they say that, oh, with this pathology, with this problem that this patient has, you can go ahead and treat. Yes, we treat, but we must co-manage with them. We don't just take that decision on our own. So it's just multidisciplinary approach that we usually deploy in such situation.
All right, thank you, doctor, for that. So we have some more question online. What is the level of pain to expect during the treatment?
All right. When it comes to pain, we all have different pain threshold. But for most people, what they experience is cramps. And now the cramps, for some, when we give them the medication that I talked about, once we give, they just doze off. And throughout the treatment, you won't even hear any sound at all. But for some, the cramps, when it's coming up, we usually give our medication at interval to be able to manage the cramps. So that is what we usually do during the treatment. So to some extent, based on the response that we get from the patient, will enable us to be able to adjust the medication that we use then to manage the cramps during treatment.
All right, thank you, sir. Okay, we have another question. Somebody's asking how much is the procedure online?
Well, the procedure itself right now is 2 million, but by next year is going to be 2.5 million. But that does not include other expenses that you need, like registration and the like. But for the treatment itself is 2 million, but by next year it will be 2.5.
What is this?
You need to come in to interact with the people in charge. You said? Oh,
Twice or twice.
and you can pay in installments, but you have to complete your payment before you can have it. We allow payment in installments. Once your payment is complete, then you can undergo the treatment.
All right, thank you so much for this wonderful session. This will be the end of the presentation for now. Do you have any other questions? Yes, say something. All right, yeah, fine. All right, so this presentation has actually opened, my eyes to also see that fibroid is not just a journey that affects just one person, it affects an individual and also the people around her and generally the quality of life of the person. And it's a journey that one should not suffer alone. You should have support people that are with you even as you go on this journey. Now here we have over 800 treatments. And so some of them are here today, and we have some people that will be giving us, sharing their journey with us, how they discovered their fibroid and the treatment that they've undergone and what their current life is now, quality of life is now. They're going to be sharing their experience with us. Please let's welcome Ms. Taiwa. Now welcome. Thank you. So just tell us about your fibroid journey and what your experience has been and what.
Oh, okay. Yeah. All right. Okay. So, when I found out that I had fibroids, when I was sleeping one night like that, and then I woke up with a sharp pain in my tummy, and then I went, to get myself checked out at my local family hospital. And they ran some tests and all that, and they said, okay, you have to go for open surgery. And I was very scared. I was like, I like hospitals. I don't want to be hospitable. And then my mom suggested that I should go to another hospital to see what they can do. And they suggested that I should go for open surgery. And the gynecologist was trying to convince me that I think you should go for it though, because sometimes in the scan they will see 3 fibroids, and then when they cut you open, you will find other fibroids hiding behind your organs. So that's the best option, So I got to work, and then I started doing my research to see what option I can go for in order for me not to go for that open surgery, because I was really scared. So that was when I found out about Monica, and I made my inquiries and all that. And then I came in and I was welcomed, of course, as we can see, like they are very professional, and then they are very honest as well, So I registered, and then I had to save some money. I didn't go for it immediately because my financial capacity was not up to par at that time. So I came in some months later, and then they advised I go for MRI scan before they start, the procedure. And then after doing that, I ran some tests to, for them to ensure that I was qualified for the procedure, because, according to what I heard, some people, they have to go through blood transfusion and all that, but I didn't need to do all that. So I knew I was in good hands because they were very honest with me, in the sense that they said, even if you go for this procedure, it's possible that you can come back again to for the same procedure in case it's not completely eradicated. So I came in with my mom, and of course, the process was before the procedure, you have to go through like like 2 to 3 days fasting, just liquid, to ensure that your system is cleared, ensure like, the procedure is seamless and smooth. So for me, all through my journey, the nurses, the staff, everyone, they were really compassionate. They gave me a high level of care, and I was not I was not scared because I felt like I was in good hands. So on the day of this procedure, I came with my mom, and then they gave me a form to fill. Then I saw some things that I'm like, do I really want to go ahead? Because for me, I'm not used to, anything surgery or procedure. So when I went to see the doctor again before we proceeded, and then he reassured me, he said, as long as you have followed all the steps and the processes that we have told you to follow, and you have not eaten, you have not done this, you have not done that. I'm like, no, I didn't eat nothing, because they said like some people apparently they don't go according to what they tell them to do, and then that's when complications arise, or maybe their threshold is high. So anyway, he reassured my mom and I that the procedure would go well, and we're in good hands, you know. So I went into the theater room, and of course, I was given I think IV drip or so. Yeah, so I was a bit drowsy, you know, it's just to minimize the pain. So I didn't sleep throughout my procedure, because I don't know, my pressure is not so high. So um, I was placed on the machine, and then I started feeling drowsy, and then my legs was dipped in cold water. I heard, well, the doctor said it's just to minimize the pain that I'm going to feel, you know, the cramps I'm going to feel and to get my body temperature adjusted to the procedure. So yeah, and they started the procedure, and it took us like an hour and 30 minutes. Yeah, so it's I'll say like I wasn't expecting that I wasn't going to cry on that day, but I felt at ease, because when the machine started moving on my tummy, you know, I started like, you know, feeling some kind of cramps, and then the nurse came in, she held my hand. So honestly, I won't lie to you, that made me feel better, because if the nurse didn't come to me, I don't know, maybe I don't know what would have happened that day, because I really like, even during my period, I experienced pain. So for me, the pain I experienced that day was like maybe times two. But the drip they gave me, it helped my situation to, you know, deal with this with the procedure. So in no time, the procedure went quick, and I was discharged that same day, and I was advised to go for MRI scan. I think a week later or so, and bring back the results so that they can see um, how the procedure has worked for the fibroids. And then afterwards, I came for 3 months checkup up to the ninth month. So as I came back for the scans and the results, there was progress, because the fibroids were reducing in size. Some used to be like maybe 70 centimeter or so, it started decreasing to 10, you know. Of course, everything did not go completely, but I felt relief during my period, like less bloating, even till now. I mean, I've had my procedure since 2023. Like, I don't even feel any bloating anymore. And even before the procedure, like when I tell some close friends, like, oh, they said I have fibroid, like, normally people say like, your tummy be big, your tummy is so flat, that whole outcome. I'm like, well, the symptoms I used to feel before, I don't feel it anymore. But even if everything has not completely gone, but still like I feel relief. I don't feel like, you know, that pain I used to feel before, like that took me to the hospital, like sharp pain in my when I'm sleeping, it does not happen anymore. So for me, I was really, really impressed, because I wasn't expecting like I'll get discharged that same day, and then, you know, like no scars, nothing at all, you know. So what I would advise, like anybody that is considering the non-invasive procedure, you're in good hands at Nordica. They're very honest. You feel, you know, a high level of comfort, care, and top tier professionalism. So for me, that's my experience at Nordica. Thank you.
Thank you so much for sharing your experience about your function. I'm ready to take on. Okay, right. So we just watched one of video online. So we've had people that after the procedure they've given birth, they've had babies, we have people that are currently pregnant. And you know, it's such a wonderful journey that you know you get all this without having to do open surgery, without cuts, without any form of incision. You don't stay in the hospital for so long. This is such an innovation that brought liberation to women. Ready?
Hi, boy. Good afternoon.
Good evening. My name is Aisha, and I would like to share my Hifu story with you. Well, in 2020, I was diagnosed with fibroids. I couldn't take the news because it wasn't one, it wasn't two, it wasn't three, it wasn't four, it was actually five. And the two largest were between 9.5 by 8.4, while the second largest size was 7.5 by 6.2, I guess. Then every other ones were smaller sizes. It was a journey of oh, pregnant woman, sorry, be careful there because I have a bulky stomach. It was quite noticeable when I'm coming, and I hear people say, be careful there, you know, you're pregnant and others, but I know that I wasn't pregnant. I really wanted a solution, and that was when I started my fibroid journey. I've visited different hospitals recommended by friends and families, and I remember very well when I finally made a decision that okay, I'm settling with so hospital. I said within myself that I'm ready. So I met with my boss and I discussed with him that I would like to go on leave to take care of myself. And he was shocked, like, oh, in this age and time, you want these options when there are better options. And I was like, no, that even when my mom had hers, because my mom was actually diagnosed with fibroid back then, but we finally lost her. Ours was even quite pathetic because it was heavy flow, and the menstrual days were like 7 days or more, I can't remember, and it's quite heartbreaking when we finally lost her. That should be in 2010. So when I told him about this, and he was shocked, like, oh, so you're not aware of Hifu surgery? I was like, no, I've searched the internet. There's nothing like that in Nigeria. And he said, no, that there is one in Lekki, and people have been going there for Hifu surgery. I was shocked, like, okay. So he gave me the address. I went online, I googled it, and I went there. That was Medical Fibroid Center in Lekki. When I got there, I made inquiry, and they gave me the bills of what I need to cater for. I went back to the office and I gave him the news that I never knew about Medical Fibroid Center in Lekki. And he said, yes, there is, because there was someone who mentioned it to him. And he feels that it's something that every lady needs to know about if they are in that kind of condition and they need a solution. I was very happy when my boss said it is a done deal, and I went for the Hifu surgery. I was very, very happy. Now in 2022, November, that was when I finally settled a date for the Hifu surgery. And I remember when few days before then, I was asked to do a lot of things in preparation for the Hifu surgery, which I followed religiously. I just wanted a solution because I've had several miscarriages, and I don't know. Friends will tell me, don't go for surgery, try to manage it. I know one Yalagbo, I know one herbal seller that is very good. That's our specialty. She will give you all kinds of concussion that can help you to shrink. And I tried that out before. I just gave up finally, like there's no solution of such. Then friends and family also discouraged me about the surgery. That most people who finally go for the surgery are those who have children already. So if you have no issues, you shouldn't even try the surgery because it will be very hard for you to conceive afterwards. So I just felt to myself that this so many complications after surgery is not something I would also like to try. So in 2022 November, I settled for a date and I went for my Hifu surgery. Like I said, in preparation for the Hifu surgery, I was asked to do a lot of things before the session. So that very day, I came quite early as I was asked to. And in few hours, I was done. I think the process was just like 2 hours, right? Yes, in preparing me for the Hifu surgery. And when I was done, I was asked to lie on my tummy. So I laid on my tummy for a few hours. Then I was asked to go. And in a few days, I was up already doing a lot. Even that very day after the surgery, I could do a lot. I went back home. I went back to my house, took care of myself. And 2 to 3 days, I was very fine, could take normal meals and others. Calls from the hospital as well, just like they want to know how you're doing, what's your well-being like. And it was really a support system that every human being would like to look forward to. It was quite interesting because they want to know what's the outcome. Are you better? Are you taking your drugs? Are you, hope you're following the rules and regulations we've given to you. And it's something interesting. Excuse me, please. So in January, I had a delay in my period and I was like, oh, am I pregnant? And I checked. I bought a pregnancy test script and I checked I wasn't pregnant. So I just said, okay, let me just go to the hospital. A few days after I checked, I did a blood test just to verify and it was negative. So I went back home. I called fibroid center, medical fibroid center, and I was told that, oh, it's normal, just be patient with the process. Since you saw your period in November, December and January, it's been delayed, I'm still fine. So in February it came, few days after, I guess it should still be in that. Yes, in February it came. So in February I was okay. I just told my husband, please, let's take it slow. I want to heal totally. I want to just be fine. So, but in April/May, I saw a delay in period again, and I was like, oh, why is my period not here again? No problem. Let me check again. So I did PT, and I did a pregnancy test. During pregnancy test, it came out positive. I was like, oh, are you for real? Okay, it's fine. I went to the hospital and I did blood tests. Blood test confirmed it again, saying that it was positive in May. I was so happy. I don't know. I wanted to scream. I wanted to do a lot of things. So I just thought to myself, okay, excuse me, I need to be careful right now because I'm actually pregnant. I don't need to do a lot of things. I don't need to stress myself and others. So I was being careful. In May, I was supposed to go in for after Hifu surgery checkup. I was actually asked, I was scheduled for May. I was scheduled for hysterectomy or something in May. So I thought to myself, I called the nurse, that's nurse Anna. She told me, oh, since I'm pregnant, I don't need to go for that. She was really happy for me, and I was like, oh, that's because what they wanted to do is just to check the cervix, check the inside and all that. I said, oh, so it's not required any longer, and that was it. So I went for 3 months after Hifu surgery checkup, 6 months after, 9 months after, and 1 year after. That was in November last month. So in all, the process, for once, even when I go for my ANC, that's the antenatal classes, and checkup, my doctor will always ask me that, my fairing, because they saw fibroid. It's still there, but they are all dead. For once, no cramps. It was just a smooth journey. Unlike most people who still have fibroid, the fibroid are already dead because the process is slicing the fibroids and allow it to shrink over time. And because the baby is there, the baby is, even when I went for my when I started the antenatal checkup, antenatal classes, I remember very well the doctor, gynecologists, every one of them were like, oh, let's check, let's do this, and they saw fibroid. I said, yes, it's there, but I've done Hifu surgery and they are dead. For once, they never gave me any painkiller to resolve any cramps or anything. There was nothing like that. It was just a smooth journey, unlike other people who had fibroid and they have to put them on a bed rest. In all, I would like to encourage someone out there who might be weighing different options on what's best option to go for. When it comes to Hifu, there's no scar, there's no need for blood transfusion, there's no what's it called, delay in period. No, if you're expecting your period at a particular time, there's a date the doctors will have to check and see, so that when your next period is coming up, it will fall in place. Today I'm pregnant and I'll be 32 weeks gone. I'm sorry, the light is off. Do you know now? They just sees power. I'd like to show you this. It's my testimony and I'm very happy about it. I want to say a very big thank you to all the doctors in Nordical Fibro Center. Thank you so much for your time. Thank you for everything, your care. The care was too much. After the Hifu surgery, I remember this one will call, that one will call, Nurse Anna, you know, every one of them were calling. Sister Christiana will call, Sister Victoria will call, this one will call. Then I think Nurse Susu was the final stage for me to see the doctor and all that. They will call to check on me, and it was really a support system to heal one within days. It's something that I'm really happy about, and I'm encouraging someone out there who is also weighing options like, okay, what should I do? Like I said, Hifu doesn't require blood transfusion. There's no scar anywhere. Oh, I cannot go to the, I don't want to go to, I don't want to swim. I don't want to wear swimsuit because of this scar. No, it's just something you have to live by. And I'm very happy to share this with everyone out there. The best option is Hifu surgery. It's an option that will give you a better tomorrow. Just like how I had my testimony. In November, I did the Hifu surgery. In that same November, I saw my period. In December, I did the same thing. So it's not something of delay that you'll be waiting for your period to come, or you have to use a particular medicine to make it to come. So I'm encouraging someone out there. If you're looking for a better option for your fibroids, please take Hifu. Hifu surgery is the best. And it's just one in Nigeria, which is Nordical Fibro Center in Lekki. I encourage you to visit with them, see what option they have for payments. I think they have payment instrumental and others. You can reach out to them and see how best you can have your Hifu surgery. Thank you so much for your time. Thank you for listening. Have a great day and stay blessed.
Thank you. Thank you so much for listening. Then based on the discussion that was had, the videos that was watched, should we have questions? Does anyone have questions based on the videos and testimony that we heard? Not for now. Okay, thank you. So the next on our agenda is to see the iPhone machine. So we're going to do a live tour of the machine. We're all going to put the doctor is going to take us on that journey to see the iPhone. And see how the machine is and look at it like that.
The other one doing that sometime, or you want to do
That is.
that is.
Yes.
No. Or all right, so you are welcome once again. So this is our theater, where we treat fibroids and adenoviruses, without hurting our patients open. So this is the machine. This one is called JC200. There are various types. Now, high intensity focal ultrasound. This type is the ultrasound type. Then is the MRI type. Those who have done MRI before, those normal MRI, but now has the IFU component of it and also used to treat the fibroids as well. Now, this is our control system. Also, in this one, we put the patient's information there. This is where I use the main screen that I use to control the machine. And then this is just the complementary screen. You display the MRI there. This is just to support the images that are getting from here. Now, this is the bed where the patient lies face down. The tummy is positioned inside this compartment. We fill this space with cold water, which bathes the tummy throughout the treatment to help ensure that the temperature is low and to prevent any bone injury during the course of the treatment. Now, this is the transducer, where the energy that we use to kill the fibroid comes from. This is the ultrasound. If you look at this, it's just like the normal ultrasound probe. Those who have seen ultrasound probe before, this is just different. So this is what we control. We focus on the fibroid, and then it generates heat that now destroys the blood supply to the fibroid. Now, you said before you come into this place, we would have interacted with you, that quickly or usefully examined you, you would have done an MRI to confirm whether it is fibroid that you have or not. We want to assess whether you are suitable for the hypo treatment. When we are done with that, we give certain instructions that we're going to do, and also do some blood tests as well to be sure that everything is okay. And on the day of treatment too, we do what we call rectal washout to ensure that the content of the intestine is not much to prevent any injury to the intestine. And then we ask the patient to lie on the machine, and then we start the treatment. We give medication to ensure that cramps that we talked about at the time we kill the fibroid is not something that will become unbearable to the patient. So the medication helps us to manage the cramps like usually occur while we kill the fibroid. Now, it all depends on the threshold of the patient. There are people that once they sleep on this like this, with the finish, no sound at all. And there are those ones that, pain threshold different. So maybe cancer or having discomfort, then just the medication to make sure that it's painful as much as possible. After the treatment, we give specific instructions to them as well in terms of the diet and medications to also help to manage the post-treatment experience as comes to also after treatment, because the fibroids now are there and they are trying to reduce the fat. So with pain, there is fluid that's water discharge, which is usually self-limiting because within 7 days there the fluid stopped. We give antibiotics to prevent any infection. So this is the box where the elementary, the power source, and also the water, which is sorry, this is a treated water we put inside this filter. So that is just the Hifu machine. Any question?
Is this how cold it gets to be?
No, we can always adjust the AC. We can always adjust. The time that you don't want AC, you can put it on.
You're not for the machine.
Is that?
It's not.
No, it doesn't affect the machine.
If you have more questions, you can write them down, where it counts.
Thank
Well, thank you.
you.
Video is off. The video is off. Okay, other people. She's one of our clients, and she can even take us through the whole process. Yeah, so this is, you are welcome once again. So this is the Hifu machine, high intensity focused ultrasound. We have three parts. This is the control system. This is the bed where the patient, and then the box over there has the water system, the filtered water, and then the power source. Now, this is where I operate the machine from, control the transducer, which is where the energy that we use to kill the fire comes from. Now, by the time we've interacted with you and we looked at the MRI and we say, oh, you're suitable for the HIFU treatment, we run some blood tests and also give certain instructions regarding your diet before the HIFU treatment. So on the day of the treatment, we do just a little procedure to ensure that we empty the intestine. That's, we call it rectal washout and mass samples. So after that procedure, we put the patient on the machine. The patient lies face down, head to this side, feet to the lower part. Now, this is the machine that I control, the transducer. We fill this plate with cold water, we place the tummy of the patient to ensure that there is no skin injury during the treatment. And then we manipulate this to ensure that it focuses on the fibroid, and then we take out the blood supply to the fibroid one by one. So when we are done with the HIFU treatment, we examine, we give contrast to confirm whether we've been able to take care of all the fibroids. If we realize that we've not treated all the fibroids, we still have the opportunity to continue the treatment, and which is one of the advantages of using this particular machine, the ultrasound guided HIFU. The other type is a magnetic resonance HIFU, because there are two types of HIFU: the ultrasound guided, which is this type, and then the magnetic resonance. That of the magnetic resonance, once the patient leaves the machine, you don't take them back into the machine. But this, we could treat, check, have we been able to treat everything? We continue with our treatment to ensure that all the fibroids are treated. So after the HIFU treatment, the patient will be allowed to rest for 2 hours to check the vital signs. And once everything is fine, we give certain instructions, and then we ask the patient to also do post-treatment MRI for us to be able to compare the fibroid before treatment with after treatment, because we need to let the client see the difference to be sure that we've really done something, not just based on our own assumption that we've treated the fibroid. We will both see it together. You see the pre-treatment MRI, you see the post-treatment MRI, you see that, oh, this one has the blood flow, this one does not have the blood. Because it's important that you understand this to be sure that, okay, they did something, not that, oh, I'm not, the whole thing was not even clear to me. I'm not sure whether they did something or not. So that is why the post-treatment MRI is very important. And it also helps us to check if there are complications or not. So after the treatment, you will start to back on your normal diet gradually and give you some medications to be able to manage some of the things that could come up after treatment, like cramps or discharge. Give you antibiotics to prevent any infection, and we also give painkillers to manage the cramps that could occur after the active treatment. And then scan is done every 3 months to monitor the shrinkage of those fibroids for a period of 1 year. So that's just the whole process. So do we have questions?
Okay, so you said if role is modified, like, how can one be really like qualified for this?
Yes, when you come in and we interact with you, take certain information from you, we ask you to do MRI. So that MRI, once it is done, I look at it, be able to see whether you are suitable for the IFA or not. So it is that MRI that we use. And that is also what we do for humans. So during the treatment, to be able to locate each of those fibroids.
You said me, thank you.
And whether you can benefit from the IFU treatments or not. Yeah. So that's what we'll be able to say, oh, we can use IFU to manage these fibroids. If we look at it and we say, oh, we don't think the IFU can be the best option in this case, then we can offer you other alternative options.
And in cases where maybe the fibroids are too large.
Yes, yes.
People
Because
will
that,
not be suitable for
yes,
that.
we look at all of that. So when we have the MRI, we look at the size, we look at the location of the fibroid, we look at the nature of the fibroid. A number of things. I just don't want to bore us with those details. We look at the whole lot when we have the MRI. I just summarize everything by saying we just say whether you are suitable or not. A whole lot is looked at when we get the MRI.
And then I,
No, the MRI procedure is not painful. It's just that it's an enclosed machine. They slide the patient inside, and then some noise during the course of the scanning to take those pictures. That's all. But for someone that is not afraid of an enclosed case, there is no issue, no pain at all.
Not for only that maybe for any person experiences such when you're entering there, you might like one woman said, is she the nurse? So the day she went for the MRI, they said that she was scared that but she was feeling more or less eating a coffee. So she was not something. So with that phobia, yeah, but there's nothing more. Fibroid made me every other thing. I wasn't scared of anything. But that day when I came, I was like, let this man come, let me see the end of this matter today. I already showed me. And I want to tell you because my mind got conditioned that if I go for surgery, I won't make it. Because I was just so scared about it. And I want to tell you this hype is just the best option. This is a huge and then I show you again that. Let me just take that. Yes, I'm just doing my 9 months checkup. In fact, I came to Lagos, nobody knew my office. That's why I'm somehow avoiding that video. But I want to tell you, I want to tell you it's a very, very good procedure. I'm just going for my maybe 9 months checkup next month. By second, I had it on the 2nd of April. And since then, in fact, after 1 week when I came here, they don't say they were like, are you the one we are seeing? Because that thing, whenever I'm having my period, if I have my period after 4 days, if you see me, you know that something happened to me. And incidentally, and this thing is not very incidentally, while preparing my bowl for the procedure, the thing they asked me to use, just after thinking and what's it called it, my period came out. When I called them, they said, come with it. So because my period was on, that was really pain. That pain on. Like in fact, that was just crying, doctor. In fact, it just there's no pain. Once you are here, even though with the period, because of the presence of that menstrual pain, that was why I felt pain. But outside that, no, nothing more. And after the procedure that day, I had to go from there to the junction. I was hold up everywhere, no vehicle. On getting there, we only found vehicle that took us to an instant field. All right. From there, I tried to, I remember that, but my sister was, she said, you don't want, like, you don't want doing this. So it's just a very good procedure when they finish you go. In fact, when my colleagues called me from the office, I said, I'm walking, they said, what are you telling us? I just thank God about this because me, I promised myself that it's either this or I go. That's fine. No, I meant it. I meant it.
So we can see the amazing thing that
Because I couldn't have gone for that.
Oh. Thank you very much, Mrs. Dunaka. All right, so now will be all if we don't have any question.
Okay, thank you.
Yeah. Okay.
Yeah, so my motion is very good. Okay, so I want to ask how effective is the IFU network for schedule?
Okay, all right. Right now, we will not be able to, you can obviously this. I will not be able to tell whether she's suitable for the IFO or not. She needs to be evaluated first. So it's after the evaluation, we ask her to do MRI. So when we look at the MRI, and then we'll be able to tell whether she's suitable for the IFO or not. So she needs to come in first. All right.
Okay, there's one question online. So the question has been asked before, but she joined late. So she's asking, after the treatment, does the shrunken fibroid fall off or what?
Okay, all right. So the fibroids after the IFU treatment, they don't fall off or they don't come out with the messes. The fibroids, they become dead tissue and the body begins to absorb the dead tissue gradually. So the dead fibroid begins to reduce in size over time, and we do scan to monitor the rate at which that reduction is occurring every 3 months for a period of 1 year. So that's what happens to the fibroid. The fibroid tissue is still present, but it's now a dead tissue that is reducing in size. So one of the questions from online says that, does the IFU affect the eggs? Now, like we said, IFU only attacks the fibroids. It does not affect the surrounding normal tissue. Even the uterus itself, it doesn't cover the entire length. We focus it on the fibroid that we want to treat. We treat those fibroids one after the other. And that tells you that it only focuses on the area that you've placed the machine. So the ovaries are spared. The intestine is spared. It does not extend to the intestine, does not extend to the ovaries. We usually do a particular hormone to check whether the IFU has any effect on the ovaries or not. We call it AMH, hormone. I usually do this for people less than 38 years of age. so that it can reassure the client that the HIFU has not had any negative impact on their fertility potential. So we do this before HIFU treatment and we repeat the test 1 month and 3 months after the HIFU treatment to compare the result. And the amazing finding is that there is a relative increase in the value after HIFU treatment for the people that we treated so far. So meaning that instead of having a negative impact based on what people would have thought, it has a positive impact in the ovarian results at the end of the day. So it does not affect the eggs.
There's one man and one. The person was asking how much is evaluation on MRI?
All right. Thank you very much.
Right, thank you, sir. So now we're going to open the floor for discussion or feedbacks on suggestion that people have for the HIFU. Do you have any?
Do you have any kind of animation, something that shows like
How the procedure works? Can you do it, you want? I'll say that.
Ultrasound beam can be brought to a tight focus at a distance from its source. Sufficient energy concentrated within the focus. The cells lying within may be killed without damaging the surrounding tissues. High intensity focus ultrasound applied fluid is therefore a non-invasive method of producing selective and fast reconstruction of different inhibition targets within the body, without causing any damage to the overlying surrounding tissue.
With the evidence-focused ultrasound tumor therapeutic system allows individual ultrasound to enter the body and focus on the lesion, killing only the tumor without destroying any healthy tissue. It doesn't cause a wound or loss of blood, and patients usually make a quick recovery after treatment. So how, by a few clicks of the mouse, does a doctor finish the treatment? As an example, let's see how the treatment of uterine fibroids is accomplished in 5 simple steps. Step 1. Locate the fibroid. Unlike an upper state, which by a hands-on operation reaches and uses fibroids, the hypnosis uses key scans on the location to find the fibroids, including those at mere 1 or 2 centimeters in diameter. Now the scan probe starts to move from the left side of the lid. Good. Pull up the fibroid is shown. Step 4. Treatment. Wait a minute before pulling trigger to make sure of 4 things. The common condition of the patient. A safe sleep pathway, guarantee and healthy, a safe water level and temperature. Focus the point of a hypnotized end right hand target. done if the non-immediate treatment is appropriate for treatment, i.e. immediate brain or power. And the final life cycle, the treatment plan 8 and 14. Now that the final will be killed, all of the painkillers and improves. There's nothing to worry about. I'll just put all the people that do power model to get the correct magnetic resonance images and these scan holders likely to achieve. Visually and feeling. Step 5. Second time contrast enhanced photopharma. The contrast agents will again and you'll find that the place where the fiber was once lifted, the highlighted, which leads to being totally validated. That's the end of a successful operation. Isn't it easier working without all the tired procedures? Even though curious diseases in our GP, do deserve a pat on the back from time to time. After the operation, nurse the uterus for 2 hours by cooling it down. Then the patient can begin having water, food, and moving around. She will be able to return to work in 3 days. The residual fibroid will be cleared by the immune system. The patient will be able to get pregnant 3 months after the operation. The Hifu knife means hope for patients, and it is an important option for doctors. To learn more about the Hifu knife training program, please follow us on our official WeChat account.
Life is the masterpiece of art by the creator. Nothing in its integrity is so worthless. Thus, respect for life begins with respect for the integrity of each tissue and organ of the body.
All right, so we can actually share that video for you then perhaps voice before you go. So next I'm going to call on Mama to come and help dissociate because whether we are that.
Why you decided to add Google this face? Don't mind that. Google is my social media name. Yeah. Is it morning or afternoon? It's afternoon. Good afternoon, everyone. It's a great pleasure to join you on this journey. I belong to the IVF family, so I just came to give the fibroid people a support today. And I want to say thank you for coming. Thank you for making a bold step to get informed, to know your options, and to also know that you are not alone in this journey. Your symptoms are valid, your pains are valid. A lot of times people go through situations that others don't understand. When you have your menses and you are in pain, I mean serious pain, especially with people who have adenomyosis, they have serious pain, they have uncontrolled bleeding. Many times others don't understand because they have it easily. Every month, people show up with their menses, and it's just come with maybe a mild cramp that they can take paracetamol, and the menses come. Some people don't even take anything. The menses will come and it will go in 5 days. So they don't actually understand what you're going through when you tell them your own situation. Sometimes even the old mothers say, oh, maybe it's in your brain. Maybe some people will tell you, oh, when you get married and you start having kids, it will ease off and all that. All sorts of things will come. But just to let you know that you are not alone, we understand your pain, we understand your situation. And coming here today is just to know that there is another method apart from open surgery. It's known all over the world. We are not the first, and we are not going to be the last to bring this into use. We are probably, I think, the second in Africa. Was it second or third in Africa, in the whole of Africa, to bring this machine? But the first in Nigeria. And
First in the whole of West Africa.
first in the whole of West Africa, yes. So for this machine to be here, so we've been having people from other places to come to Nigeria to have their treatments done. It may be a new thing to us in Nigeria, as a lot of people they're still skeptical about the use, but we've had stories from people who have done this. Someone is pregnant currently, others have had their babies. So it's not something that is abstract, and I'm glad you have seen the machine. The first time I had the opportunity to see the machine live, I made a post and I said, this is a wonder, because you just lie down for 1 hour plus, and your fibroid is technically gone. Not gone, like you remember she mentioned it, it's still there, but it's been killed. So if you have a new fibroid growth, that's a different thing. It's not the one that has been killed, because if you kill something, it's not going to come back alive again. So if another one grows, that's a new set of fibroid, and that can also be dealt with. So your story is valid, your story is genuine. Don't let anybody tell you that it's not genuine. And don't let anybody put you down that are you the only person that is menstruating, or fibroid unfortunately is a common thing nowadays. And we'll continue to do our best to give you the best care that is possible. So thank you for coming. And let us also tell other people about this. Make it, I wonder, I think it's only in Nigeria that we keep things. Many years ago, IVF too used to be like that. People don't come out to talk about their fertility challenges. Yeah, I can even understand if you're unable to have kids and you don't want to share your story. But fibroid is nothing. It's nothing to be ashamed of. You can put it on your story. You can put it on your WhatsApp story, on your Facebook, your challenges. You never can tell, but please don't listen to people who will tell you to come and take agbo. You will take agbo 100,000 per month and it's not going to go away. Your symptoms are not going anywhere. They will just continue to tell you, take this, take that, and it's not going to help. And again, one thing I want to beg you is not to allow anyone to give you something that you are going to insert into your vagina. That's a no. In whatever form, do not agree to anyone telling you to insert something into your vagina, because you don't even know how it's going to end. A lot of people have ended up with scar formation in their vagina that they cannot have sex. They cannot, even to menstruate is a big problem. The whole place is scared, and so let us be careful of the things that we do. We know that in Africa, maybe because of the cost of a lot of things, we tend to look for cheaper options. Cheaper options can land you into trouble. So let us share our story. Let us tell people about Hifu. Let us tell people about some Hifu and adenomyosis, Hifu and fibroids. We've seen it, and it works. I've had the opportunity to go to China, and the number of people that would come in for Hifu procedure on a daily basis is alarming. They don't even have the size of fibroids that we have here. They don't even have it, but they do Hifu every time. And I think I would say I thank God for Chinese. God has given them the wisdom. Hifu is the future of everything. That's the truth. They are using Hifu to treat a lot of things, but we are not yet there. We are still even struggling to tell people about Hifu and fibroids. They are using it for a lot of things in China, a lot of things, and evidences are there. Some in Egypt, there is a doctor that we met in China, is not doing fibroids, but is doing cancer treatment. He's using it for cancer treatment, but we're not there yet in Nigeria. At least let us fix our fibroids and get people informed before we go into all that. So thank you all for coming. And people online, thank you also for coming. I hope you have learned one or two things. And let's also endeavor to share this on our social media pages so that other people can learn from it. Thank you.
Thank you. All right, thank you. Thank you, Ma. We appreciate it. Thank you, everybody. Let's wait for item 7. Everybody, thank you for coming. We really appreciate you for coming, taking our time to come here. Thank you so much. Yeah. All right,
So people have one or two things to add.
Then what kind of question that they want to like to ask the doctor?
Maybe one-on-one. You have a one-on-one with the doctor.
At the moment.